Okay, so this is PowerPoint F, articulations and axial skeleton. I'll probably divide this into two, maybe 25, 30-minute lectures. Okay, classifications of articulations/joints. So two different ways to classify a joint. Either how does it move or what's it made of. So the type of movement would be the functional classification. What's it made of, what type of connective tissue is holding it together, that would be the structural classification. So you got functional versus structural. So let's do the easy one first. Functional, how does it move? Does it move not at all, a little bit, or a lot? Okay, Synarthrosis, no movement at the joint. So look at your skull bones, like in between your frontal bone and your parietal bone, that connection there is called a synarthrosis. S-Y-N, I think it means together in Latin, like when two molecules are synthesized and together and become one. So Amphiarthrosis moves a little bit. Symphysis pubis, in between the vertebra, intervertebral joints, those all move a little bit. And you go, wait a minute, the pubic symphysis moves a little bit? Yeah, if you're having a baby, it does, right? It moves a little bit. Your intervertebral joints each move a little bit. It seems like, your backbone is moving a lot, but really that's just each joint moving a little bit, and they're all stacked on top of each other. A diarthrosis is a freely movable joint. And generally there's a cavity with synovial joint, filling that cavity within it, or within a capsule, basically. So like the elbow, the knee, the fingers, the wrist, those all move a lot. So synarthrosis doesn't move at all. Amphiarthrosis moves a little bit, and diarthrosis moves a lot. Okay, so next slide. Where's my next slide? There we go. So synarthrosis. IS is singular, ES would be plural. Synarthroses would be plural. So the bony edges interlock, the connective tissue fibers attach the bones, or tissues are fibers, and the epiphyseal plate in a developing long bone technically is a synarthrosis. That's kind of a weird one. Probably I would point at this, like that sutural joint and that skull. I go, what functional joint type is that? And you go, synarthrosis. If I wanted to do a bonus, I would go, the epiphyseal plate does not move. So technically they're calling that a bone and that a bone, even though, yeah, the whole thing might be the humerus. So I would go, what functional joint is that? Bonus, and you go synarthrosis. But it's kind of a cheesy one. So, but it does fall into that category, I guess. Amphiarthrosis moves a little bit. Remember intervertebral joints and pubic symphysis, those were good examples. Also, in between, like the radius and ulna, the tibia and the fibula, those joints, right? They can move a little bit. They can twist on each other a little bit, like right in there, right in there. And that's called an amphiarthrosis also. The actual membrane itself is called an interosseous membrane. That's just a structure. You have one in between your tibia and fibula also. We'll talk about that later. Diarthrosis, remember I said you generally have a capsule, and they're freely movable. Wide range of motion. The bones do not contact each other technically. So that's a diarthrosis, moves a lot. Okay, so three general groups of structural. So we're getting away from function. How do they move? And we're talking about what's holding them together. So fibrous joints, held together by fibrous connective tissue. Cartilaginous joints, held together by some kind of cartilage. Synovial joints, held together by an articular capsule that we were just looking at one. You know, it has a joint cavity, a knee or an elbow is a good example. So let's take, let's go to the easy one first, synovial joint. There's a cavity between the bones. The ends happen to be covered with articular cartilage on these bones. That helps reduce friction and absorb any shock. There's a capsule, fibrous joint capsule, with a synovial membrane. See, it's kind of in pink right here. And that's making synovial fluid. So, this is held together by a capsule. So, it's a synovial joint because it's got synovial fluid in it. Is it freely movable? Yeah, but then you're talking functional. Right now, we're talking structural. What's holding it together? Let's back up and go to cartilage. So if your joint is held together by some type of cartilage, it's either going to be hyaline cartilage or fibrocartilage. So if it's fibrocartilage, remember that? We've seen microscope slides of that. The pubic symphysis is a good place to find fibrocartilage, remember? Also, intervertebral disc, good place to find fibrocartilage. Those joints, intervertebral joints, in between the pubic bones right here, also, that joint, that symphysis joint, those are called symphysis joints. This one's easy because it's the pubic symphysis. It's in the name, right? So if it's held together by fibrocartilage, they call it a symphysis joint. The intervertebral joints, those are called symphysis joints also because they have fibrocartilage. Okay, this is a kind of easy one to remember. Syn, remember it means together. Chondrosis, together with cartilage. It's in the name. Best place for this to look for on the human body, first rib to the sternum. Okay, that's a really good example of a synchondrosis together with cartilage. Okay, yeah, is an epiphyseal plate held together by cartilage? It is, but like I said, that's kind of a cheesy one, right? So it's a synchondrosis structurally. It's a Synarthrosis functionally because it doesn't move. So store that in the back of your head. I know it's confusing. Right now, let's just look at the really good one. First rib to a sternum. That's held together by hyaline cartilage. That's a good hint example of a synchondrosis. Okay. So just reiterate here. If it's held together by cartilage, it's either going to be held together by fibrocartilage or it's going to be held together by hyaline cartilage. If it's held together by fibrocartilage, it's called a symphysis joint. If it's held together by hyaline cartilage, it's called a synchondrosis. First rib to a sternum, really good example of a synchondrosis. Epiphyseal plate, kind of a weird example of a synchondrosis, but technically it is. Okay. Then fibrous joint. You got three different kinds. So let's do the easy one first. Sutural joint. It almost looks like a suture. It looks like somebody stitched this up, right? And it's held together by little fibers, collagen fibers, basically. So that's a sutural joint. Now let's go to the one down here. This is a weird one, a tooth and a socket. Remember you have a periodontal ligament around each tooth? And that's holding that into the bone, right? So that's called a gomphosis. Nobody ever seems to miss this just because it's got such a weird name. So if I point at a tooth and a socket and I go, what kind of structural joint is that? Notice I forgot to say be specific. So technically you can go, oh, that's a fibrous joint, and you get credit. Probably I'm wanting you to say it's a gomphosis. So I said be specific. Then it is a fibrous joint, but it's called a gomphosis. So it'd be nice if you said gomphosis and then put in parentheses out beside it, fibrous joint. Same thing with sutures. If you go, what kind of structural joint is that? You go, sutural joint. maybe put in parentheses, fibrous. This is a weird one. Syndesmosis, long connective tissue bands. So remember that interosseous membrane I was telling you about? That's holding those two bones together, right? And it's called a syndesmosis. Together, I don't know what the desmosis means. You'll look it up on Wikipedia. Maybe they'll come up with something. You're probably just going to have to remember this one. So syndesmosis. That's like in between radius and ulna is a syndesmosis, held together by long connective tissue bands, and also in between the tibia and fibula on the lower leg, syndesmosis, held together by those connective tissue bands. So fibrous joints, you have three different types: sutural, syndesmosis, and gomphosis. Okay, so don't lose your big picture. Three big structural joint classifications: fibrous joints, cartilaginous joints, synovial joints. Sometimes I just ask an essay question like that. What are the three big classifications of structural joints? You go fibrous, cartilaginous, synovial. Give me an example of each. Here you could go sutural, you could go gomphosis, you could go syndesmosis. Cartilaginous, you could go together with cartilage, synchondrosis, or you could go symphysis joint. Synovial joints is synovial joint, right? It's held together by the capsule. So you're kind of done there. All right, so don't lose your big picture here. Three big classifications of structural joints and three big classifications of functional joints. Notice all the functional joints end in arthrosis, arthroses. So it's only three classifications of functional joints and you're done. Moves a little bit, a lot, or not at all. So this one moves not at all. That one moves a little bit. That one moves a lot. Where structural joint classification, you have three big classifications, but then you have subdivisions. You got three different kinds of fibrous joints. You got two different kinds of cartilaginous joints. And synovial joints, just synovial joint. So there is no subdivision there. So hopefully, you're going to just have to sit down and write them out. Don't mix up structural versus functional. Functionals, how does it move? Structurals, what is it made of? Right? Okay, let's talk a little bit about synovial fluid. I could go name a couple of functions of synovial fluid. Provides lubrication. It nourishes the chondrocytes. It's also like a little shock absorber. So think about it. If you ever chipped any cartilage, like on your knee or wherever, it takes a long, long time to heal because there's no blood supply to this cartilage, right? It gets all of its nourishment from this synovial fluid. So it will heal, but it takes a long time. Okay, and then if that little chip is floating around, sometimes they might actually have to stick a little scope in here and look for it and pull it out like an orthoscopic surgery. And then hopefully it'll heal, where it chipped. Accessory structures, menisci, meniscus is singular, ligaments connect bone to bone, and tendons connect muscle to bone. And we talked about how tendons are made of dense, regular connective tissue. Meniscus is kind of like a little structure that subdivides the joints. They're pretty tough. Kind of shaped like a meniscus in a test tube when you pour some fluid in there. So those are just structures, and I can point out them on the knee, like, you have a medial meniscus and a lateral meniscus in the knee joint. We'll get to that. Bursa, small pockets filled with synovial fluid. These are kind of specialized things. And so they keep stuff from rubbing on other stuff. So see that tendon's got the bursa around it. It's keeping it from rubbing on the bone and then this ligament, right? So can you get an inflammation of a bursa? Yeah. And so that'd be called bursitis. So that can hurt. It almost feels like arthritis, but it's not. It's nothing to do with the bone. It's the actual bursa is inflamed. And they can treat that with anti-inflammatories and different meds. Okay. This is just motions, generalized motions. Don't stress on this too much, but make sure you know if something moves in one plane, like this elbow, it just moves in one plane. That's a uniaxial joint. The common name is a hinge joint because, like a hinge on a door, it only allows that door to move in one plane. Biaxial joint, kind of like the saddle joint on the thumb, will let it move in two planes. A triaxial joint, generally they shape kind of like a ball and socket, and they can move in all three planes. That's easy enough. A gliding joint, in between your clavicle and your sternum, the top part of your sternum, the manubrium here, it can glide. You can feel that on yourself if you feel right there and then move a little bit. You can feel it move. That's a gliding joint. Whereas a pivot joint, kind of like this, your atlas and axis, your cervical vertebra 1, cervical vertebra 2, and it's almost like a little axle poking up there. And so it can rotate around it. That would be a pivot when it rotates around it. I doubt I would do ellipsoidal. They're gliding, but they can glide in more than one plane. Okay, so uniaxial, one plane, biaxial, two planes, triaxial, three planes. Pivots like a rotation, gliding joint is gliding in a plane like that. Okay, probably not going to do ellipsoidal. We'll come back to whiplash. That's mostly a ligament question. What ligaments get stretched whenever you hyperflex. This guy is hyperflexed in the neck right here. Here he's hyperextended. We're not going to talk about bony destruction like it does in here. We'll learn about the ligaments around the vertebra, and then so which ones are getting stretched or torn when you do this versus this. So we'll come back to that. So here's the spine, normal curve of the spine. This is the front, that's the back. So that's the cervical vertebra. So you got 7 cervical vertebrae. C1 and C2 have their own names. Remember, atlas and axis will come around. We'll talk about that later. You have 12 thoracic vertebrae. Remember, you have 12 ribs on each side, okay, that come off of here. And then you got 5 thoracic vertebrae. And then your sacrum is fused vertebra, and then same thing with your little tailbone, the coccyx, C-O-C-C-Y-X. Those are kind of fused there too. It's a little tailbone, okay. And by the way, that kind of points to the front. So that's the way you can tell, oh, that's the front, that's the back. So on a male, generally this points a little more to the front. On a female, it's more straight up and down. Just makes more room for the birth canal, for the baby to come through, okay. These are just spinal abnormalities. I don't know if this is out of 167 out of the 9th edition or the 8th, but it should get you close. Scoliosis is a lateral curvature of the spine that should not be there, right? This one's not done that well, but lordosis is a lumbar curvature that's in the proper direction, but it's too much. It's an exaggerated lumbar curve, where an exaggerated thoracic curve, it's in the proper direction, but it's too much. That would be kyphosis. Okay, so scoliosis, lordosis, and kyphosis. Make sure I have asked either multiple choice or fill in the blank on these. Okay, there you go. Scoliosis, lordosis, kyphosis. And I think that's a picture of scoliosis there, an x-ray. And if they catch that early, sometimes they can put you in a brace as you're growing and correct that. Or there's also surgical interventions they can do also. Ligamentum nuchae. Nuchae just means neck. So that's see this supraspinous ligament right here? When you get way on up by the cervical vertebra, it just gets real broad, and it goes up to the back of your occipital bone. You have that little bump back there, the occipital protuberance. So it goes to that, and they call that the ligamentum nuchae, but it's also the supraspinous ligament. It's same thing, just got its own name in that cervical area. All right, we'll learn some of these other ligaments too. This would be this anterior side, anterior longitudinal ligament, right? Longitudinal is not a very good anatomical word. It sounds like something out of your geography book. But remember, these were named long time ago. This will be a posterior longitudinal ligament. See, this is the anterior. That's posterior. And this is your spinal cord, by the way, in here. So on the back of these bodies, there's your posterior longitudinal ligament. Then in between the little spinous processes, right, back here, that would be interspinous ligament. Inter means in between. Supra means above, basically. Supraspinous would be this guy. And we're leaving out one. See this little guy that kind of skips? That's called the ligamentum flavum. It's in the roof of these arches. So it's kind of hard to draw this, but this is inside that arch. And it almost sounds like a scoop of ice cream at Baskin Robbins. I'd like a scoop of ligamentum flavum, please. So in other words, this would be the arch, right? This whole area right here would be the arch. So on that side of it, you can't really see it here. That would be the ligamentum flavum. Okay. Here's an intervertebral disc. This is the spinous process. This is the back. So your supraspinous ligament would be here, coming towards you. You know, because we're looking at this from the top. Okay. There's an intervertebral disc, the way they're supposed to look. And you see these collagen fibers going around and around and around. That's called the annulus fibrosus. And you probably heard that word annular before, like the earth goes around the sun annually, right? From the same root word. Inside of a disc it's pulpy. It's called it's kind of mushy. And it's kind of like shock absorber. And that's called the nucleus pulposus. Here, this is herniated. So this is a problem. This disc is herniated and it's pressing on the spinal nerve. Can cause problems, right? All right. So, almost done with this part of the lecture. But let's just talk a little bit about structures on the skull here. This is called the nasal septum. All right. So this perpendicular plate of the ethmoid, we talked about the ethmoid bone a little bit. It hangs down and it connects with this little bone down here called the vomer. Those two things together make up the nasal septum. Now it's important to realize this is not something you can touch from the outside. This is inside. So when you look at a skull, you'll see it in there. So that's the septum that you always hear about. Oh, I had a deviated septum and I could only breathe on one side of my nose. And the doctor had to go in there and break it, do a surgery and straighten it up. Pretty fairly common problem. Okay, but I could just go, name two things that make up the nasal septum. And you go, perpendicular plate of the ethmoid bone and the vomer. I could also go, name 9 bones of the orbit. What's the orbit? That area right there, right? The bones around the eye socket. So it's 7 of them. And there's a little saying, you got to spell please wrong. P-L-E-S. Please feed my zebra. Stupid little saying, but it helps. P stands for palatine bone. That little piece of, you can barely see any of it right there. Palatine bone. A lacrimal bone right there. Ethmoid bone, you can see part of it in green there. Sphenoid bone, you can see part of it in purple here. You're only seeing parts of these bones, right? The maxilla, which would be in this kind of goldish orange, or this orange. And we left out frontal. Frontal in this gold, right? Maxilla we did here, orange, and zygomatic bone would be in the blue. That's your cheekbones. This is lateral. That's medial. Okay? So I could just ask it easily and go, name the 7 bones of the orbit. Right? Don't just write, please feed my zebra, although I may give you 1 point for knowing the same. But P is palatine, L is lacrimal, E is ethmoid, S is sphenoid, F is frontal, M is maxilla, and Z is the zygomatic bone. Okay, so those 7 bones make up the orbit. Now, on a real skull, I wouldn't point at something tiny like this ethmoid or this piece of palatine right here. They're just too little to see. Color-coded guy like this, yeah, maybe I could do it. But you might go, palatine? I thought your palate was way down here. What's it doing? What's this bone doing up here? Well, it has little wings that poke way up, or a wing on each palatine bone, right? And one goes to this orbit, one goes to the other orbit from the other palatine bone. And you'll see that on another slide. Okay, so this, I like these questions too. This is your zygomatic arch, right? What 2 things make up the zygomatic arch? See this in red right here? It's the zygomatic process of the temporal bone. What's this little blue protrusion? That's the temporal process of the zygomatic bone. So, the zygomatic process of the temporal bone and the temporal process of the zygomatic bone make up the zygomatic arch. If I do it the easy way, I just put the tape over the whole thing. You go, what is that structure? And you go, zygomatic arch. But I could easily ask, name 2 things that make up the zygomatic arch. Then you have to spit those out. This, see where they drew a line through here? If you were to cut that across like that, that would be the skull cap. Like when they do an autopsy, a lot of times they cut through here like this. That's going through more than one bone. So don't start naming bones. If I have the whole skull cap sitting on a table, if it was a real test, I go, what is that structure? You'll go, calvaria. Now, be careful here. I think your book's wrong. I learned it calvarium, U-M, because it's singular. Calvaria is plural. So I don't know if they've changed it or if the book made a mistake. But anyway, take it for what it's worth. I'll take it either way. So here the calvarium or the calvaria has been removed, and you're looking down in there. And then we'll cut it off about right here. But this is the sphenoid. Remember, we were only seeing parts of that sphenoid looking in the orbit? That's where the pituitary gland sits, by the way, in that little dip called the sella turcica, which means Turkish saddle, like a saddle that they rode on horses sometime back in Turkey a long, long time ago. I guess that's what it looked like. But that's where the pituitary gland sits. But this, it kind of looks like a bat. Some people call it the Batman bone. Don't call it the Batman bone. You won't even get a quarter of a point. But anyway, we'll start on this next lecture. So, alrighty. That's about 27 something minutes. So we'll just end this here, and I'll put this on YouTube for you. Okay.